All right, guys, we're going to be talking about spinal stenosis today. So, spinal stenosis usually occurs in individuals over the age of 65 and it hurts a lot with extension. Okay, so for those of you who do not know what extension is when you kind of lean back, when you're standing, when you're walking, when you're going up and down an incline. That's extension. Going up and down stairs, you're in an extended position. If you lay on your stomach and then lift your head up, that's extension. If you lay on your stomach in bed, you're in an extended position. So people who are over the age of 80 or 65, pain with extension, you could almost say with 90 to 95% confidence that they are suffering from spinal stenosis. So what that looks like here in the video is going to be the different layers as you saw, L1 through 5. Three things really happen with spinal stenosis. I want to stop this video here. So like we live outside of DC. There's a road there called 66. So 66, let's just say this is a nice little 4-lane highway that we have driving down, okay? And then all of a sudden you're going to converge down into a beautiful thing called Vienna. Vienna itself is where the metro station terminal is. So you have 4 lanes going into 2. This little intersection here where that occurs, that's kind of where your spinal stenosis occurs for a visual, okay? So we're going to play this out here. You're going to have your disc degeneration where the disc starts to break down. You start getting that herniated disc. In the back here, you're going to start getting that arthritis coming through at the joint. So if anybody had an x-ray performed, they saw 2 things: degenerative disc disease. So this is degenerative disc disease. If they saw degenerative joint disease, that's going to be back and through here. And then if they hear anything about bone spurring, this is going to be where the bone spurs form around where the joints are itself. So between the compression of the herniated disc, the bone spurring, the joint degeneration, all that's going to do is it's going to cause a nice opening here at the spinal cord to slowly start to shrink down to the point where there's compression on the spinal cord. So spinal stenosis usually affects people over the age of 65, hurts with extension, and individuals will feel symptoms down both legs if they are in the periphery, but mostly centralized to the lower back. Once again, this is Dr. Robert Woelkers. I'm a physical therapist, and I own 2 clinics here in Northern Virginia. And I'm going to be doing a lot of these lecture videos for you guys to have a little bit better understanding. A lot of patients have reached out to me and asked for this information. So if you know anybody that would like or that would benefit from these videos and you want to like or share, please send it to them. And then also, if you guys want to subscribe to our page, we'll have a lot of cool stuff coming up in the near future. So then that way you guys can get that information. Also, if you guys want to leave a comment down there in the box, just to let me know if it was a good video, if it was informative, if you guys need me to add anything, I really love your comments and your feedback from it, because that's kind of how we generate the videos off of, depending on what you guys want. So once again, this is Robert here with PT Anatomy. I use 3D Medical, and it's a great app for any PTs that are watching this video and want to use an awesome anatomy app, 3D Medical. It's called Complete Anatomy. I don't have an affiliation with those guys. I just love their product, and that's kind of what I use. So once again, spinal stenosis. Dr. Robert Woelkers signing off.